Let's move on. I'm delighted to say we're joined by Maire Treasa Ní Cheallaigh, a colleague of ours here in OTB who's been studying medicine in the RCSI, the Royal College of Surgeons, just over the road from us, and over the last few weeks has been volunteering on the front line after she was asked to volunteer and help patients with COVID-19. MT, how are you?
I'm good. Also, not in my birthday suit, fully dressed. I just feel the need to get that out there, including
for our radio listeners. It's okay. Everybody watching can tell. Are you in scrubs? Are you?
No, not in scrubs right now. But I do have to say, whenever I do go in, there is a section obviously where you go in, you get into the room, you find the scrubs you're going to wear for the day, and obviously they're laid out by size and stuff. And like they're usually there in blue, sometimes red. But there's always like a small set of maroon ones, and I'd like to feel that they leave them out, especially for me. I always wear the maroon scrubs if I can at all.
What has this been like, and how, so for anybody who's unfamiliar, what stage of your medical career are you at the moment, and how do you end up getting involved?
I call myself 50% doctor, so I'm halfway through the degree. It's a 4-year graduate entry degree, so normally medicine would take a bit longer than that. I sat an exam about 2 years ago to try and get into the fast-paced stream, so to speak. Somehow got in. I don't know how. I collected potato packets or something, whatever. But I'm in there anyway. So I have 2 years done. And with every year that goes by, they get a little bit more clinical, a little bit more practical. So in first year, I was based, like you said, in town, in just across the road from OTB Towers. And then for the last year, we were based out in Connolly Hospital in the academic centre, which is great for learning because you're in the lecture theatre and then they're like, okay, let's go see this now. And you're taken up and you go across the way into the hospital where you get to meet the patient and the doctor will talk you through. So it was a really good way to learn. It meant we weren't totally green either. They kind of threw us in from the deep end from day one. We were meeting patients and that kind of thing. So I'm at that stage where I'm probably not that useful, but useful enough that I understand what they're talking about and can follow instruction, if that makes sense. So I think maybe that's why when they were looking for the extra sets of hands, they were able to ask, medicine students who had done a little bit of clinical work to ask us, would we be able to volunteer to go in and help them in ICU, if that makes sense.
So you're volunteering to help in ICU. Does that mean you're in the ICU? Does that mean you're helping the people who are going into the ICU? What on a day-to-day practical level do you end up doing?
What you do is basically you go into ICU, obviously you put on your scrubs, and then you put on the personal protective equipment, the PPE we've all heard so much about. And that's probably the most stressful part of the day. Not so much putting it on, but taking it off, obviously. They call it donning and doffing. So you're putting on the suit, so to speak. In Connolly, where you're wearing kind of white kind of hazmat suits, for the want of a better phrase to describe it for people maybe to imagine. You put that on, you're putting on 2 pairs of gloves, we're putting on the sanitized goggles, we're putting on the mask, making sure there's no air getting in or out. You're covering your head and you're just constantly sanitizing your hands and you're just making sure that you're protecting yourself and also protecting others, because obviously when you leave the hospital, you want to make sure you're not taking anything with you. So that's what we're doing. And then our job is to go in. We go in teams of 4. So me and 3 other students, and our job is we get called by somebody in ICU or critical care, usually the anaesthetist. They're the person kind of in charge of dealing with these very, very ill patients. They're intubated and they will let us know if patients need help. What we do is called proning, and it's basically moving patients onto their stomach to help them breathe, to keep it very, very simply. The evidence is there now apparently with this kind of viral infection that you can take a lot of pressure off somebody's lungs by lying on their stomach. Because if you can imagine lying on your back, if you can just imagine yourself, your heart and all your internal organs are pressing down onto your lungs. So by turning yourself around, you're just creating a bit more oxygen saturation. That's the ladybird, completely non-scientific version. That makes sense in my head. I'm sure there's respiratory consultants maybe listening to this going, dear God, how did she get into doctor school? But that's my understanding of it.
We've obviously seen those pictures from Italy of the patients on their front over the last while, and we at the start of this, I think everybody was fairly addicted to finding as much information as you possibly could from whatever available source. The endless scrolling kind of was a significant feature of the early part of it. For you, who has medical knowledge and is increasing your store of medical knowledge all the time, what was that early part like, and how did the whole urge to volunteer come about, and how did that happen? What was that process? What was the mix of those two things?
I won't lie, I wasn't the first person to put my hand up. I did wait a few days to see how it went out, and I think it's important to say, because I think there's this whole mythology going out right now about healthcare workers and doctors and nurses and everyone who works in hospitals and physios and all the healthcare disciplines. It did take me a while to decide, did I want to do it? It's not easy, and the first day was terrifying. But I think really, like you said, it's the fear of the unknown and the scrolling, and then also knowing that, thankfully, touch wood, even though Ireland has had suffered awful tragedies in their families that will never be the same after this, it seems to have been controlled, and that made me feel a lot better about it. And I spoke to some of my classmates and they said, yeah, it's very well controlled. They felt safe, they felt protected. So that's kind of how I came from. And like anything, any kind of fear most of us have is due to the unknown. And then once I actually knew what was ahead of me, and then once I actually went in and worked in it, I realized that, yeah, it's very high stakes, but to be fair, every effort is being made to mitigate against anything bad happening to you or your own family, if that makes sense. But yeah, thankfully so far, because it's been so well managed, because the Irish people have done such a good job of flattening the curve, there's been no chaos, not that I've seen anyway. It's all been very organised. Everybody knows what their role is. There's plenty of staff, there's plenty of doctors, there's plenty of nurses. Everybody is looked after to the best of their ability, if that makes sense.
It must be pretty exhausting.
It can be. The heat, and this is where I say again, there is obviously, we come in and we come out and we're called on duty and we're stood down off duty. Compare that to doctors and nurses who are in there for hours in that personal protective equipment. The heat just saps the energy out of you. If you can imagine, you're breathing in. If you can imagine a mask on your mouth, there's no air coming in, there's no air coming out. Those clothes are warm. Hospitals by nature are warm. You're in a high state of kind of adrenaline. I am anyway. I'm kind of standing like this, ready to go. And then you're doing very physical labor. And then you're coming out and you're doing that a few times a day, depending on how long the shift is or how many shifts you've volunteered for that week. And then you come out and there's a bit of mental exhaustion. And I think that's probably something that healthcare workers are going to have to be careful about in the weeks and months ahead, that there's a lot of mental processing that probably isn't being done right now, if that makes sense. And people will have to take time, take stock, process what they've seen, process what they've gone through, be that either patients who've gone through it, relatives of patients who've gone through it, and people who've actually worked in a healthcare setting as well. Like, once eventually COVID-19 goes away, the scars will still be here. And I think that's something we need to be careful about when it comes to mental scars. When it also comes to, we've heard the anecdotes now of people not going to hospital because they're afraid maybe of being a burden to healthcare, or maybe afraid of catching it. And then so many elective operations and procedures and appointments have been kind of just kicked the can down the road. If that's not dealt with, we're going to deal with another kind of post-COVID crisis that could be, maybe the figures mightn't be as obvious, but people are still could still get very, very seriously ill because of it. And we just need to be very, very careful about that. And that's why I was telling people, you know, we see the curve flattening now, and that's exhausting too. Like, there's nothing more exhausting I can imagine than being at home with 2 or 3 kids and trying to keep them indoors and trying to keep everyone safe. So we're all feeling a bit itchy feet now, but this is the long haul. Even eventually, once people get let out, there's going to be repercussions or ramifications, at least for the next 2 years, I think.
Maire Treasa, what's your view on how this is going to change society and how we behave and interact with one another down the line?
Ooh, that's a big philosophical question on. I'd like to think it will change things for the better. I would like to think that employers will, now lots of employers do, let's not paint them all with the same brush here, but I'd like to think that those who perhaps showed less trust in their employees before to be working might suddenly realise, actually, Joe or Mary is getting on very well at home. I'm going to let them work from home a day or 2 a week. Just can you imagine what that can do for quality of life when not everyone is constantly stressed about being out in the M50, trying to get into town, driving around cities and towns of Ireland. We've all seen the gridlock around towns like that. I think that would make a big difference for people's physical and mental health, because all of a sudden, if you're not commuting 2-3 hours a day, can you imagine that time you now have back? You can spend that with your family, you can spend it on a hobby, you can go outdoors. I really hope that might be the big change, that people might start prioritising lifestyle, kind of working to live, not living to work, if that makes sense. I really hope that'll be the big thing. And I really hope as well that we don't suffer from short memories, that we remember, you know, it's only last year nurses were out striking, looking for extra money. And the work they do is amazing. They are saints. I don't know how they do it. That we appreciate healthcare workers, that we appreciate the money they earn that they don't earn, that when we crib about consultants earning 6 figures, yeah, but that woman or man has been training for 17, 18 years, you know, and they've worked really long hours, unsociable hours, they've sacrificed a lot of personal time to get to that point, that we tend to have a better, more holistic picture of what people do to contribute to society, and that we're just a bit nicer to each other. I know this probably sounds a bit Rose of Tralee, but if there's one thing I've noticed over the last few weeks, it's that people seem to be nicer. Like, I'm a country girl. Like, if I walk around in Yarrow at home, I'm saying hello to people as I walk past. That never happens in Dublin. It's happening now. So I kind of hope that stays. I'm looking at my apartment block here. I never knew, and I knew one woman in the block. I now know a lot more, and I see two elderly residents here every day when the sun shines. They go down and they have tea down where the sun trap is, and they do their social distancing, but they're having the chats, and they never knew each other before this. So hopefully, that's what I kind of hope, that we just value being the human experience. And I know, geez, that sounds very deep for this hour of the morning, but I just hope that we don't forget that, and that we don't go back to the rat race.
Yeah, I mean, I hope you're right. I really hope you're right, because we're still, and look, we're as guilty of it in this show as everybody else, talking about like what's the way back? How do we get back to? And the question has to be, what are we going back to, as opposed to how do we get back to normal? How do we get back to 80,000 on All-Ireland final day? How do we get back to the Aviva being full for the Six Nations? Like it's a long way away before any of that actually happens. And who knows? Like we haven't even really got our heads around the possibility that there might be another strain, that if this happens once, the likelihood of it happening again is now more likely to happen again than less likely, given that this strain can mutate and the vaccine takes a while to catch up, and it's like, actually, this is going to put our health system under the exact same strain that it would have done in the past. So how we live with whatever is coming next is going to be the challenge for everybody and all of the countries of the world. And there's going to be big differences between approaches. Like, you can already begin to see that fissure with Trump defunding the World Health Organization. So, I mean, it's fairly scary times.
Yeah, it is. And I think maybe, funnily enough, again, you see different countries reacting differently. You have a big section of the United States who've decided, oh, science means nothing. I want to open up my economy and that's it. And we all know how Trump defunded the little pandemic unit they used to have to keep an eye on viruses just like this. So that already meant the world was on the back foot. We saw the UK reaction, and we saw how Boris Johnson paid very dearly for his reaction. And then we have here yet in Ireland, thanks be to whoever you believe in, that people still give kind of weight to what the CMO says, what public health says. And that's the big worry, because we're seeing countries like ours, and we're not perfect by any means, but I think we're doing our best. And we're seeing other countries worldwide doing their best to try and overcome this, to move on. But then how can we actually move on when you see other countries actually just turn their back on best medical advice? And that'd be the big worry. So what are we going to do if we've created a nice little island here where we do know, where we have contact tracing, that we all know if somebody gets COVID-19, we can do the contact tracing. We know how to keep them, subsided for 14 days. So we can kind of get back to normal in a smaller kind of way. Are we going to stop flights in from America? Are we going to stop flights from the UK? Is Northern Ireland, is it going to follow our rules? And this is where we're going to have the conundrums and the questions. And even when the vaccine arrives, I saw yesterday Novak Djokovic saying that he wouldn't be that keen on taking it. And this is the world now that anti-vaxxers have wanted. And yet you still cannot talk to them to explain this is why vaccines are a good thing. And actually, I remember before Christmas, I was in a lecture. It was about the flu. And the amount of people that don't take the flu jab every year, despite the fact that we know it kills you. And I remember the lecturer saying that we were due a pandemic, that had been time that one would come around the corner very, very soon. And that we were very lucky with SARS. About 15 years ago at this point, it didn't really reach here. They had MERS in the Middle East that didn't reach. We had the swine flu, and we always skirted. Did Owen get swine flu?
He did, on the day that Kerry won All Ireland as well.
Oh dear.
If there's any sort of indication that we should not be going back to 82,000 people in the stadium, it is that very piece of evidence.
You think so? You were fine going to the final, was coming home that you got sick?
No, it was actually, I remember it was after a fry up on the way up that I started to get sick. So somewhere in the Midlands, but yeah, you're
so
right.
You were the super spreader. You went to Croke Park and you spread the swine flu.
Yeah, it was worth it though. Kerry won the All Ireland. That's all that matters. That's a joke. That's not a very sensible thing to say right now. It's a good point though. They did feel, because like when you think about, say, common practice over the last couple of months, like coughing into your elbow, like washing your hands properly, all that sort of stuff, like that has been rolled out previously in Ireland. And with the bird flu, with the swine flu, that you're right, that they were actually near misses. And perhaps at the start, we all kind of thought it would actually just reach that level and it wouldn't get much worse, until we realized we were all very, very wrong.
But I was one of those people too. I remember in January and February telling people, it'll be grand, don't worry. Sure, most people don't even know they have it. And unfortunately, even I didn't. And I was in, like, the big thing that we study in second year in graduate entry medicine is microbiology. And even I, despite being told this morning, noon and night by lecturers, was going, sure, it'll be grand. It'll only be like a mild flu, a mild cold for most of us. And unfortunately, that is the way. But the difference, I think, between this one and SARS was that it was very easy to tell if you had SARS. You know, you were symptomatic nearly immediately, whereas this has, as we know now, up to 14 days incubation period. And that's the problem with this one. We just don't know who has it. And we're going to be waiting for antibody testing, or we're going to be waiting at the very least. I mean, I'm no expert. I'm only listening to experts. And I feel from what I've been seeing and reading online and listening to people that maybe instead of antibody testing, what's going to happen to maybe help reopen things up and get us back to normal is that we might find a good antiviral drug that if you do catch COVID-19, if it does affect you in a really adverse way, that the antiviral drug might be a cure, which that seems to be very great because that's not going to work for everyone. And at some point, society is going to have to decide, is the trade-off worth it?
Yeah.
You know?
Yeah, and look, that's the big philosophical questions that we're going to be grappling with for the next while. Speaking of big philosophical questions, MT, I know that you're obviously going to be very busy over the weekend saving lives, but the other thing you have to do is to decide who's going to go on the Galway Mount Rushmore. I think you've got about a week to do it, or
yes,
about a week to do it. So I know it's a really difficult thing to do, but I mean, generally, Paul Rouse had good criteria. I need to have seen the person play live, but obviously Diarmuid Ling put Nicky Rackard on yesterday. So you make up your own. It's your mount. It's your mountain. You get to pick. And I'm not going to ask you.
I couldn't be doing with that now, because then, like, obviously, I mean, there's people from Galway, wonderful Galwegians, who I've never seen playing, but I'd have to have them in contention. That'd be ludicrous. How could you have a Galway Mount Rushmore without discussing Joe Connolly for a start?
Okay, so well, fair enough. At least you've seen Connolly on the video. There's, you know, so anyway.
I have, and there's a very embarrassing photo of a 15-year-old me getting an award from Joe Connolly.
Bring it in, send it in to us. That's our opening shot. MT, enjoy it, and enjoy the consideration of who deserves their place and go. And we'll talk to you again real soon. Thanks a million. Stay safe.
Cool. Thanks, lads. Bye-bye, Slán.
It's Maire Treasa Ní Cheallaigh there from the sideline to the front line. Right, Michael Lasser's going to join Maire Treasa next Monday morning at 9 o'clock to decide on the Galway Mount Rushmore.